Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
Do you have a treatment coordinator in your dental practice? Do you need one? And what exactly are they supposed to be doing on a day-to-day basis? And what metrics should you be using to determine their value to your practice? We'll be talking about this and a whole lot more in this week's episode of Dental Business RX, the dental treatment coordinator position. What should they be doing? I'm Jeff Bloomberg, and I'm your host, and I'll be joined shortly by Sabri Bloomberg, the Deputy Chief Operating Officer here at MGE. Sabri is in charge of all of our technical delivery. And what we're going to be doing is breaking this position down. We're going to be exploring just about every aspect of it. So if you have a treatment coordinator, or if you're looking at hiring one now or at some point in the future, this is an episode you're not going to want to miss. So I think we have Sabri all set up now. Sabri, are you with us?
I am.
Okay, good. She's actually sitting right in front of me. I'm just making sure her audio is going. So obviously it is, yeah?
Yeah.
Okay, good. So treatment coordinator. This is, first question. You talk to a lot of our clients on a day-to-day basis.
Yeah.
So how often are you asked about this position?
Quite often, actually.
Like a couple times a day?
Well, no, not a couple times a day. And I think there's a better understanding now of what it is than there was, let's say, 5-10 years ago.
Yeah, because the position started sort of in ortho.
Right. That is where it originates from. It started out in ortho because in ortho, they had a position that was solely focused on sales.
Right.
Right? They are the ones, like the doctor would do the diagnosis, and then the treatment coordinator would sell the treatment plan. And this was an isolated position from the rest of the organization. That's all they did.
Right.
And they called it a treatment coordinator.
Right. I think the full name, back what I heard several times when I'd go visit various orthos in my treks across the U.S. over the years, was treatment plan coordinator was the full position name, right?
Right. And that probably was a better name for the position than just treatment coordinator because it's more descriptive.
Well, and also, don't we find a lot of people, like when they first come in, if they have a treatment coordinator, they have them doing all types of random things?
Well, that's the interesting thing is when treatment coordinators started entering general dentistry, that's when the confusion began.
Okay.
On what exactly are they, right? And what exactly do they do? So a treatment coordinator could be anything from a scheduler to, I've seen assistants be treatment coordinators, like anything really you could call a treatment coordinator, right?
Okay.
Just depending on the viewpoint of the doctor.
I see.
Because there was no position in dentistry where we had one isolated person that just sold treatment plans. And especially in the smaller practices, that really wasn't necessary. The doctor would do the sales.
Right.
And then lately, in like the last 5-10 years, as we've seen doctors build bigger practices and it's become more of a thing to build bigger practices or multiple practices or associate-driven practices. That wasn't a thing 15 years ago. Some people did it.
Yeah, it was isolated.
Right. It was isolated that you saw it. But now maybe with the advent of the DSOs or whatever, I'm not sure why, but more private dentists are thinking bigger. They're making bigger practices now that these practices are larger. They have associates. Now you need a treatment coordinator. So they go get a treatment coordinator. But the dental model, traditional model, doesn't lend itself to a treatment coordinator.
I see.
Because the doctor's always done the sales. So
Right.
it just becomes this really ambiguous position.
I see.
Yeah.
I see. So, okay. So we want to break this thing down now, just for our listeners out there. I have to warn you, if Sabri and I decided to talk about everything with relation to treatment coordinator, this would be basically an audiobook.
Pretty much.
Yeah. And as a matter of fact, Sabri did an entire course, a dental treatment coordinator training course on our online platform, DDS Success. If you want to find out more about that, you can visit it at, it's my shameless plug, at ddssuccess.com. But, so what we had to do before we sat down to do this podcast is Sabri and I sat down to more or less hammer out what areas we wanted to cover. So I think probably the best way to roll with this is I'll kind of go down the list you and I made, and you can kind of give your feedback on that. That might be the best, yeah?
Okay. Well, obviously, we don't have enough time in this podcast to make a professional treatment coordinator. That's what a course is for.
Sure.
But we're definitely going to hit on, okay, this is what they do so that at least they're focused correctly on the basic functions that they are responsible for.
Fair enough.
Yeah.
All right, so I'm just going to run down our list of questions, and I'm going to let you roll.
Sounds good?
Okay, good. So first, what is the purpose? Like, describe this position and what its purpose is.
Okay, well, I guess the easiest way for me to explain it is a treatment coordinator in a normal business, in a non-dental setting, would be called a salesperson.
Okay.
And that explains it right there. It's your salesperson. In a normal business, a salesperson is responsible for taking the product that the customer either needs or wants and working out the financials with them so that they can afford it.
Okay.
It's a salesperson. That's all it is. It's not a scheduler. It's not an assistant. It's not your business assistant. It is not your insurance coordinator. It's a salesperson.
Interesting.
Yeah.
Interesting. And what type of skill sets would you be looking for? If I'm looking for a treatment coordinator, what type of skills am I looking for in that prospect?
Well, I would want somebody that is obviously friendly. Right. I want somebody that's outgoing. You can't have an introverted. I mean, again, things with a salesperson. You can't have an introverted salesperson.
Right.
You can't have a salesperson that's afraid to talk to people. You can't have a salesperson that's not excited about the product that they're selling. Right. So you want somebody that's outgoing. And I'm not necessarily talking about bubbly. Well, you're looking for somebody that has excellent communication skills.
Okay. So when you say bubbly, just to clarify, we're not necessarily looking for a social butterfly.
No. I'm looking for somebody that can communicate.
Okay.
Right? I don't want it calmly. That doesn't mean necessarily that they're conservative, but they can be if they can communicate calmly and are interested in the person that they're talking to, and they're interested in the product that they're selling. There has to be some personal conviction.
Okay.
On the salesperson's part in the product that they're selling in order for them to be effective at sales.
Okay.
Yeah.
And so obviously they'd have to be comfortable discussing fees and finances.
Well, yeah.
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 So you can't have somebody say, I hate money. Okay, be my treatment coordinator.
Yeah, or I hate taking money, or I'm comfortable discussing money. That's obviously not something that a salesperson that's going to make a successful salesperson.
Well, and part of it, because we're used to talking about the concept of sales, because this is something we go over very early on with an MGE client. Like, you're essentially selling as a doctor.
Yeah.
But you may have, obviously, there are people listening to this that aren't our clients, right? Yeah. So they may hear the idea of sales and healthcare and freak out. You know? So how would you explain that? Just because, I don't know, there might be somebody out there going, oh, sales, we don't sell, blah, blah, blah. But what would your thoughts on that be?
Well, you provide a service, whatever that service may be, right? And currently in the United States, 100% coverage for dental work does not exist.
True.
Which means that there's going to be an out-of-pocket expense, right? Ultimately, the reason why patients are coming to them is because they are a doctor and they want to be healthy. It's up to the dentist to educate the patient and be their doctor, right? And get the patient on board, or at least explain why having the treatment plan that they feel is best for the patient actually executed is in the patient's best interest.
Like, they almost have to create a want on the patient's part.
Well, yeah, because not everybody is education-wise at a point where they know how important dentistry actually is. But if you take a look at what is the derivation of the word doctor, right? It's actually from Latin, and it's from the word teacher.
So it derives from Latin. I think, what is it, docere or dotere or something?
Teach.
Interesting. Yeah.
Right.
Yeah,
That's exactly right. So the first thing a doctor does is educate their patient on what is happening with them and what they need to do to achieve optimum health and why that would be important to them.
I see.
Right?
Yeah.
Now, if you want to help that patient, they have to execute your treatment plan. Right? So unless you want to do that for free, they're going to have to pay you for it.
Right. So that's, in essence, that's why we call this sales. Yeah.
And that is the definition of sales. I'm really sorry. And, sales may have gotten a bad connotation to it at some point or another. But unfortunately, if you can't get people to pay you for the services that you want to do with them, you're not going to help a lot of patients.
That's true.
Right. So in a dental practice, it's very interesting. The amount of money that dental practice makes is actually a direct representation of how many people they're helping.
That's true.
If they're getting a lot of patients, but their income or their collections are low, that means their patients aren't following through on their treatment plans. They're actually not helping their patients.
And in order to do that, that's why, obviously, I mean, we know this. This is why we do the whole early on clients do all the sales training.
Exactly. You have to be able to effectively communicate with people.
Right.
You have to be able to effectively educate them. And you have to be skilled enough to handle the financial end of the conversation.
So basically, when we're looking at this treatment coordinator position, so I'm the doctor, I'm presenting a treatment plan, I'm telling the patient, we talked about this in episode 1, you know, one of the things you want to do is give the patient the fee,
Yeah.
right? So I've given the patient the fee minimally. I can go a little further depending on my time constraints or whatever. I should be able to go further, right? Which I'll explain in a second. But so I give the patient the fee. I then turn it over to my treatment coordinator who, so to speak, closes it, wraps it up, handles the finances, and makes sure that that patient's on my schedule.
Correct. The person that takes the money is the one that's closing it, period.
Got it.
Right? Always. Now, if it's a smaller practice and the dentist has time on their schedule to have that discussion with the patient, there's absolutely no reason for them to have a treatment coordinator. If I have a practice that's doing 40, 50 a month, right, the only reason I would have a treatment coordinator is because the doctor doesn't want to have that discussion.
Well, but then that's a problem.
Exactly. That's a problem.
That's, to me, like obviously if a client showed up and said, well, I have a treatment coordinator because I don't like discussing fees, that's why they're doing 40 or 50,000 a month
That's
and doing
exactly
just
right.
what insurance covers.
That's exactly right.
Right. So you don't want to replace what you can do.
That's exactly right. And especially if it's something that impacts the growth and health of your business so much, the sales end of it, and impacts your ability to actually deliver your product, which is a healthy patient, and to help people, right? This is a skill that every business owner has to develop, unfortunately. So treatment coordinators for smaller practices simply cover up the inability of the doctor to have this discussion.
Well, and usually what I've seen with clients, tell me if I'm wrong, but what I'll see is normally as they're starting to expand, the doctor is picking up and getting better at selling. Usually the OM is being the treatment coordinator, the office manager. Then eventually it gets to the point where the office manager is doing 5, 6, 7 treatment presentations with the doc a day.
You don't have a manager anymore.
Right. Now you got to get a treatment coordinator.
Right. And way before it gets to that point, you want a treatment coordinator. Right. You also don't want to turn your manager into the treatment coordinator.
Right. I had somebody ask me that recently.
What?
Well, their manager was a very good treatment coordinator.
Yeah.
I mean, they were also the manager.
Right.
And the question was, well, you know, we're going completely off the rails
totally
here,
fine.
but why not? Well, why don't I just make the manager the treatment coordinator and get another manager? And I said, well, here's the problem.
Yeah.
It's sort of like in the hierarchy of personnel you're trying to find.
Yeah.
Because again, we've gone from the mindset in the industry that there's front desk people and back office people.
Yeah.
Right. So obviously with an MGE client, they're starting to specialize these positions a bit. You know, there's a schedule coordinator, there's a financial coordinator, et cetera. But as far as finding personnel, in my view, at least in my experience, it's harder to find a good treatment coordinator than, let's say, a schedule coordinator.
Yeah, absolutely.
Okay. I mean, eventually maybe a schedule coordinator is good and moves up to the point where they're familiar enough and they can become a treatment coordinator.
Sure.
But it's harder to just right off the bat find one.
Yeah.
It's a lot harder to find a great office manager than a great treatment coordinator.
Correct. And the reason being that being a good treatment coordinator is simply one of the skills we expect an office manager to have.
Right.
Right. It's one of the things they need to be able to do. Your office manager needs to be able to do every position in that organization competently. Right. But that's the same as saying my office manager is a great scheduler, so I'm going to have them be the scheduler.
Right, or a great dental assistant. Or
right. Dental assistant. You see that sometimes. You see the office manager being the dental assistant. Well, it's the exact same thing.
And we've had some of our best OMs started chairside.
Right.
Yeah, some of the best managers on the that have come through the MGE program.
Exactly.
Yeah.
But what people do dictates what position they wear. So to call a dental assistant an office manager is silly.
Right, unless they start becoming the OM.
Well, yeah. I mean, that's a whole different function. And funnily enough, an office cannot survive without an office manager.
Right.
Right? A business cannot survive without somebody running it and taking it somewhere.
All right. So based on this, sorry,
no, because I can go off into the office manager thing for the next 5 hours.
We are doing another podcast about that.
Are we?
Remember? Yeah. Office manager.
Oh, good.
Yeah.
Yeah.
Okay. So what do we get from this is one, it's a sales position.
Yeah.
Okay. 2, we're looking for somebody who's got good communication skills, is willing to talk finance, and isn't backed off or freaked out by that.
Correct. And they have some personal convictions
Sure.
about, like, they have to believe that what they're selling is important.
Exactly.
Right.
And then if you are, obviously we can't have a treatment coordinator just replace the doctor's willingness to sell. The doctor also has to be able to sell.
Correct.
Okay. And then if you're a manager, and you happen to be wearing this treatment coordinator hat a bit, you have to watch it, because if that starts to spiral out of control to where you're being the treatment coordinator more and more, you need to get one.
Correct. And the other thing that you can take a look at is, okay, so maybe we're only seeing we have a manager that's only doing 3 or 4 case presentations a day, and we consider this manageable.
Sure.
Right. Well, then if we take a step back and we take a look at how many patients do we have with outstanding treatment plans that maybe aren't scheduled or aren't coming in to get that treatment done, right? That's what the treatment coordinator would ordinarily be working on.
Which is what I was going to ask you about in a second.
Okay.
Sorry, but go ahead and finish.
But that's what the treatment coordinator would be working on when they are not with patients, right? Well, the manager is not doing that. So again, we're missing out on so much treatment that could be getting completed that's simply not getting completed because we don't have an office manager and a treatment coordinator.
Fair enough.
Yeah.
Okay, so one last question. I know we're not supposed to, this wasn't on our approved list of questions here, but I'm going to ask you.
Yeah.
Because I get asked this a lot when I'm lecturing, and you probably get asked this a lot. So the doctor's doing a treatment presentation.
Yeah.
When should the treatment coordinator be in the room with the doc?
It depends on the size and type of sale that's being made.
Okay.
Right. So if I have a very large treatment plan, let's say I'm presenting a $60,000 treatment plan, well, the doctor's going to want to have that treatment coordinator with them the entire time.
All right.
Right. If it's just a couple of units that the patient needs to do in order to complete their treatment plan, you can just the doctor can just hand it off to the treatment coordinator afterwards.
So like 3-4 inlays, sure, fine.
Yeah. It completely depends on the size of the case. Also, if it's an existing patient and we've been talking to this patient about this and now we're having that final conversation about it, is it critical that the treatment coordinator is there? I'd like them to be there if it's a larger case, but it's not absolutely critical. If it's a new patient that's unpredictable, we don't know how they're going to respond. We don't know. Because you have to take a look at it. The doctor may have handled certain things with that patient.
Okay.
That the treatment coordinator was completely unaware of because they weren't there.
I see. So during the discussion, patient brought up objection X.
Correct.
Doctor handled it.
Correct.
So treatment coordinator didn't see that.
Didn't see that. Now the patient comes to the treatment coordinator. Patient brings up again objection X. Mm-hmm. Right. Well, first of all, the treatment coordinator does not know how the doctor handled this.
I see.
Right. So you want to handle it the same way. Second of all, that's a bit of a problem. Why is this not handling? Mm-hmm. Right. Or maybe there's something else that the patient is concerned about, and now they're just throwing out objections to get away from the treatment coordinator.
Got it.
It happens in sales. People run away when you're trying to sell them. Right?
Which, by the way, I have to mention. So this is about you. So Sabri did the entire treatment coordinator training course on DDS Success. It's close to, I think Adam, our producer here, what is it, like 5 hours long? 4.5, 5 hours? Yeah, it's a big course. And a lot of it is, there's all the training on how to do the job, what you do day to day, but then there's also all the demo shots.
Yeah.
And we threw some great demos in there because Sabri, took all comers there. She was going to handle it. I think one of them was, because you've had this happen to you probably if you're listening at home, where patient, doc's presented the treatment plan, sends him off the treatment coordinator. Doc leaves the room, finishes the handoff, and the patient says, "Yeah, I'm not doing this."
Yeah.
So I think you did that in one of the demos, right?
Yes.
Yeah. Thanks, doctor. Yeah. Okay, good. Yeah, I'm not doing this.
Right. Right. And these are things that actually happen.
Right.
Right. So obviously, there's handlings for this, and we're not going to get into them for sake of brevity, right? Mm-hmm. But a lot of it can be avoided. It's far more painful with these bigger cases where the doctor has invested so much time.
Right.
Right. So you want the treatment coordinator there the entire time.
Okay,
it should
good.
be very smooth.
All right. So I'm going to stay on task now. I'm going to ask you the next question.
Yes.
Okay. So describe to everybody listening, if you could, what exactly would this job look like? What are they doing on a day-to-day basis? Because I think everybody can understand the idea that they're at treatment presentations. Mm-hmm. But describe what else they do.
Okay.
Well, lay out the day if you want, however you want to do this.
Well, if I can take a step back
Sure.
into what should the treatment coordinator be taking responsibility for?
Okay, we'll
Right?
start there.
What is their big statement of their job? Right. So they are there to help to assist a doctor to make sure that every single treatment plan that the doctor has diagnosed has financial arrangements.
Okay.
Wouldn't that be great?
That'd be
Every
awesome.
single patient under the care of the practice is either actively working on getting healthy or they are already healthy, being maintained in hygiene.
All right, so financial arrangements are done and they're on the schedule to get their treatment done.
Correct, because why does a dental practice exist after all? Is to get a healthy patient, not to get a healthier patient or to do dentistry.
Right.
Right, your doctor's office, your patient should be healthy, right? So when that doesn't mean that the treatment coordinator is only responsible for selling the cases that are coming their way. That would be an extremely limited view.
All right.
So I'm only selling the cases when they are here or when somebody sends them to me that they need to buy something.
Okay, so I'm a new patient. I'm in the practice. Doctor saw me, sends me to you. Or I'm a recall patient. I'm in the practice. Doctor saw me again and sent me to you.
That would be a very limited scope of the job because what about all those patients? I mean, if you print out your incomplete treatment list out of your software, it's usually, when I do this with new clients, one of the first things that I have them get me is a list of all their incomplete treatment, just to get a little bit of an idea of how much of a backlog do we have in sales, right? And it's usually ridiculously long,
Right.
right?
All right, let me ask you a quick question.
Yeah.
All right, I don't want to be that host who interrupts all the time, but I have to ask you this question.
Fine.
Because I get this question a lot. So I'm a treatment coordinator and I'm doing 3 treatment presentations today, 2 new patients and a patient of record, an existing patient that's coming out of recall. So that's 2 to 3 hours of my day. All right. So you just mentioned stuff about incomplete treatment lists or whatever, because that's what I'm going to be doing the rest of my day.
Yes.
Could you describe how you would approach that? So you're working the incomplete treatment list, right? Or you're working the overdue list you mentioned. How does that look?
Okay. So obviously we're doing the follow-ups,
Okay.
right? And I mentioned
Yeah,
that.
you mentioned the follow-ups. Yeah,
Okay,
yeah.
good.
That makes sense. So that's the person who was in last week and I'm following up.
Correct. And that's important. Now, the one thing that we don't want to do with that incomplete treatment list is call them and try to sell them dentistry over the phone.
Interesting.
Right. So I'm not calling that list going, hi, Jeff, this is Sabri from ABC Dental. How are you doing today? And you go, I'm fine. Well, I don't want to go, listen, remember those 2 crowns the doctor talked to you about? Are you ready to schedule them?
No, I'll just talk to you guys next time I'm in.
Exactly. And you just said it, next time I'm in. Right. It's far easier to sell somebody the treatment that they need when they're in front of you than over the phone. Right.
Well, it's funny that list is never a good source of filling the schedule.
Well, you get lucky. You do get lucky. It does happen. Right. And that's okay because, that's fine. That's fine. But you don't want to plan your day on that. Right? The most important thing that I'm going to be doing is I'm going to try to get the patients with outstanding treatment back into the practice.
Okay.
Now, there's 2 different ways to do that. I can bring them in through hygiene. So if they're scheduled for hygiene soonish,
Yeah.
I'm not going to schedule them.
You're just going to wait till I come in.
Yeah, I'm just going to wait till you come in. Let's say you come in next month. Why should I call you back in?
Right.
Right? If you do not have a hygiene appointment and you're due for hygiene, I'm just going to schedule you to come in for your cleaning. I'm not even going to bring up your treatment.
Interesting. So you're going to do it as the treatment coordinator. You're not going to wait till the
Absolutely.
scheduler does it.
No, and I'll tell you why. Because I am the salesperson, which means that I have a responsibility for making sure that certain sales quotas get made.
Right.
Right? I mean, I assume in your practice that the doctor has a collections target.
Right.
Right? That they're going for, collections game they're going for the month. Right? Well, how do you think those collections get made?
Right.
Through sales. They don't get made through production. Right?
Yeah, that has been how it's done. It's just a little backwards.
Well, you can't produce it unless it's sold first. Obviously,
True.
It does need to be produced, but you're not going to produce on somebody and then work out the money afterwards, I hope.
Some people do that.
Right. But it's not a good idea.
No, it's a very bad idea.
Yes. You end up with a big accounts receivable,
Right.
right? So if I have a certain collections target that I'm responsible for making, that means I have to sell a certain amount of dentistry every day, which means that, okay, you might send me 3 or 4 patients today with outstanding treatment plans, right? But if that's not enough to make the number that I'm going for, I need to augment that with more sales. So I'm going to make sure there's enough sales on the schedule every day,
Interesting.
right? To make sure that that sales quota gets made every day. Don't forget, I am a salesperson, right? And don't forget that those sales represent how many people we're actually helping,
Right.
right? And that, I guess, is the most important thing that everybody needs to keep in mind here as we're saying sales to people who may hear that for the first time represented in a dental practice and going, oh my goodness, we don't sell, we
Right.
are a professional establishment. Well, you won't be an establishment for very long if you refuse to sell.
Right.
Because there won't be any money to keep your business going.
True. All right. So we've got, if I'm on the incomplete treatment list,
Yeah.
and I'm scheduled for hygiene in the soonish near future, you're just going to wait till I come in.
Yeah.
You're not going to bother with that.
Yeah.
If I'm on the incomplete treatment list and I am due or overdue for hygiene, you're not going to even bring up the treatment. You're just going to schedule me to come in.
Absolutely. I'm just going to schedule you for your hygiene appointment.
Right. Which, again, this reason I asked you, that's kind of like, that's a new idea because not a lot of people think that way. They go, oh, well, that's the scheduler's job. Right?
Right. And that would be great if the scheduler had time to do all of that, but apparently not, because otherwise they wouldn't be in the incomplete treatment list with no hygiene appointment.
Right. So you're staying in control of your job, getting those people back into the practice, right?
Correct.
Okay. So now here's the third scenario, which I thought your solution for when you told me was excellent, which
Yeah.
is, so let's say I'm on the incomplete treatment list.
Yeah.
I'm on 6-month recalls. I was in 2 months ago.
Yeah.
And I'm not due for another 4 months. Are you going to wait for 4 months till you call me, or what are you going to do?
Depends on what it is, right? If it's a health-related issue that the doctor diagnosed you for, so I'm not talking about like something aesthetics.
Right, which
Right,
fine.
or
Yeah.
something like that I can wait with.
Sure.
But if it's a health-related issue that the doctor wanted you to do the treatment for right away, and the doctor did not want you to wait on it, yeah, I'm going to call you and I'm going to bring you back in for a complimentary consultation.
All right. So, how might that look? So you're calling me.
Yeah.
I'm scheduled for a recall 4 months from now.
Yeah.
All right. And I came in 2 months ago.
Yeah.
And I told the doc I was going to think about it. And I ended up leaving the practice for the day and whatever. Right.
Yeah.
So now you're calling me.
Yeah.
How might that look?
I have to say, hey, Jeff, this is Sabri from ABC Dental. How are you doing
Oh, hey,
today?
Sabri.
Hi. Listen, the doctor wanted me to reach out to you. Do you remember the last time you were here? The doctor wanted you to do those 3 crowns for those cracked teeth. Do you
Oh,
remember
yeah.
that?
Yeah. I told him I was going to think about it.
No, that's totally fine. That's totally
I'm
fine.
going to have to wait.
Yeah. No,
Yeah.
I totally understand. And we know that's a big decision.
Yeah.
Right? The doctor asked me to reach out to you and schedule you for a complimentary consultation just so that he can have a look at it, make sure everything's stable until you're ready to proceed with this.
Well, I'm coming in 4 months. Can't we just do it then?
And he is definitely going to look at it in 4 months, right? But 4 months is a long time from now, and I assume you're planning on using your teeth between now and 4 months.
I am.
Yeah, so since they're cracked, he just wants to make sure it's not getting worse.
Got it.
Yeah.
Okay. How
And-
long is it going to take?
It's like 20 minutes.
Okay.
Yeah,
And then we just go ahead and schedule it.
exactly.
Yeah, I thought that was awesome. I know I've talked to a lot of clients who have done that. It's worked out really well because
Yeah.
sometimes, and we can't get into the mechanics of it. Obviously, we go over this in our sales seminars, the
Yeah.
ABCs.
Yeah.
There's a certain sales process this person's in the middle of. And
Yeah, and-
they've been in the middle of, you know what I'm talking about.
totally know
and
what
for
you're
MGE
talking
clients out there, you know what I'm talking about.
But I mean, aside from that, me saying, "Hey Jeff, how you doing? This is Sabri from ABC Dental, and I want you to come in to talk to the doctor about those 3 crowns that you're not ready to do now."
Yeah, that would just be like, no, I don't want to do that right now. I already
Right?
told
No,
the doctor
I totally
no.
understand, but the doctor really wants to talk to you about it.
Yeah, no.
Yeah, that's going to go over really well.
Right, but I like that you're having them come in to check that it's stable, gives the doctor another shot to talk to him.
Yeah, and the truth is they do need it. And how often do we hear stories that they didn't follow up and the patient didn't get
Right.
that cracked tooth crowned. And now they come in as a root canal on an emergency.
That's
we hear
true.
it so often.
Right, we do.
Right. And
we do.
every doctor will have a story like that.
Yeah, everybody's got a story like that.
That's exactly
if not
right.
multiple. But that's why it's interesting because I've heard from what I was going to tell you is they're somewhere in the sales process. And I've
Yeah.
heard from a lot of clients because I know you've told quite a few clients to do this.
Yeah.
How they had patients that they had started the process with, presented it, whatever, something came up and
Yeah.
patient didn't convert that day. And then bring them back in for what you're describing.
Yeah.
Who then just, they were able to finish the sales process at that point.
Absolutely.
Heard that
And
a lot.
Usually when the patient comes back in, they will proceed with the treatment at that point. They know they need it.
Yeah, I know. Yeah.
Right.
Because then I come in next week, let's say, if I'm the 4-month from now recall guy.
Yeah.
Yeah, it'll be like, yeah, you're right. I should probably just do this.
Yeah, and it doesn't matter whether a person has money or not. Nobody really, and there's not that many people that enjoy being sold,
Yeah, that's true.
right? I mean, it does happen. I do know people that enjoy being sold, but it's rare,
That's true.
right? And that doesn't mean just because the patient doesn't enjoy being sold doesn't mean that they are not thrilled to have the treatment completed.
Right.
Right. So you just something you have to help them through.
Fair enough.
Yeah.
Okay, so last question.
Yeah.
If I could, I know you mentioned something about consults earlier as we were going.
Yeah.
I didn't have that on my approved question list, so I figured you might want
Lord.
to talk about, yeah.
Okay. So a consult. So in the scenario we just talked about,
Yeah.
that is considered a consult.
Okay, so that, and then we talked about this in episode 1
Yeah.
of the podcast, setting aside consult time.
Yes.
So this is what the type of things we would put in consult time. This among other things.
It's essentially time reserved for sales.
Got it.
And this is a sale, so I'm going to stick it in a consult time.
Fair enough.
Yeah.
That was an easy answer.
There you go.
Okay, so last question.
Yeah.
Metrics.
Yeah.
How am I measuring whether my treatment coordinator is doing a good, mediocre, bad? Like, what am I using to measure their performance?
Okay. So ultimately, since the viability of your business is tied to how much sales you do, right? The overall statistic of a treatment coordinator is total dollar value treatment closed.
Now, total. So, in other words, how much treatment was closed in that week, month, etc.
Exactly.
How would you define closed in this sense, though?
Meaning proper financial arrangements made.
Because that's a big deal.
Yeah.
I've talked to people before who say, yeah, I presented 6 crowns. The patient's doing 2 a year
Yeah.
with what insurance covers. That's not closed, is it?
Well, 2 are closed,
That's a good point.
right? So they get to count to 2.
Right.
Right. But then that's the main statistic. Now, one other statistic you would have them keep is total dollar value treatment presented.
All right.
So that when you run into a scenario where you're presenting 6 crowns, the patient really needs 6 crowns, and I'm only closing 2. That discrepancy is showing up if you compare those 2 stats against each other.
I see.
Like, hey, I'm only selling 30%. I'm only selling what insurance covers. I obviously need some help with my sales. I'm not doing a good job getting the patient to take responsibility beyond the fact of what their insurance will cover.
Got it.
Yeah.
Okay, cool. I mean, obviously, we could go on with this for forever.
Yeah.
Okay, so here's one last. Anything else you want to add before we wrap it up as far as becoming a better treatment coordinator or selecting one? Anything that comes to mind? Anything you want to do to sum it up?
Just like with any position, whether you're a treatment coordinator or assistant or a hygienist or a doctor, right? Or an office manager, whatever your position is, what makes you a professional is the amount of training or education you have in that subject and how much drilling or role playing you actually have in that subject. So you're not going to go from not being good at this to being a good treatment coordinator without education and drilling. It's just not going to happen. It's the same thing as theoretically, let's say I get a brand new dentist out of dental school, has had a lot of education, no practice.
Right. They have to actually do it.
Well, yeah, but they practice on typodonts and
Oh, I
everything.
see what you're
not-
saying. Like they've done no practical. It's all been
Right.
classroom learning.
Correct.
Ugh. Yeah, that probably wouldn't work.
Correct. So,
Assuming they made it past the boards. I don't know how that would work, but
correct.
yeah.
Yeah. So you want those two components to make a professional out of somebody, right? And then, of course, you do it on the real deal over and over and over and over until you get good at it. Same with treatment coordinator. So there's very few natural salespeople, right? And even though somebody might be a natural salesperson, the amount of pieces that go into this particular position, because it's not just how much money you make, right? It's also, does every patient that is under your care have proper financial arrangements for the treatment that they need in order to be healthy?
Right.
That's the job.
Interesting.
Right? That's the job. So the follow up on that, how do you organize your day? How do you construct a schedule so it's a proper balance between sales and production? How do you utilize the doctors? How do you interface with the hygienists? All of that. It's quite a job. It's probably one of the bigger jobs combined with the office manager in a dental practice, and a
Right.
very important one for the right practice. I mean, treatment coordinator is not for every practice. So if you are going to be a treatment coordinator or hire a treatment coordinator, right, make sure that this person has the education and the drilling that they need, or you provide that to become good at it.
Got it. Which, as I was mentioning earlier, they could do the DDS Success Treatment Coordinator course.
Well, obviously, I'm biased to that one because I like that one because I delivered it.
Well, but also there's the they should get more sales training. We do the communication and sales training at MGE.
Exactly.
Yeah,
And
there's
if you're a doctor, you need a lot more than the treatment coordinator course
that's true. That's true.
because your business depends on your ability to sell and deliver dentistry.
Right. Okay, good.
Yeah.
Well, Sabri, as always, thank you. You were awesome.
Thank you.
Very much appreciated. And folks, we'll put all the links for all the things we mentioned in this podcast up on the podcast page. I think that sums up the whole position really, really well.
Yeah.
And if you have any questions, we always appreciate any questions or feedback. You can email us at info@mgeonline.com, or you can email me personally at jeffb@mgeonline.com, or Sabri at sabrib@mgeonline.com. We will see you at the next episode. Till then, do great.